Hey guys, it's Dr. Tim Jackson with another episode of the Boss Body Podcast. Today I have a very special guest with me, Dr. Jack Wolfson, DO. Dr. Wolfson is a board certified cardiologist and is the founder of naturalheartdoctor.com. After 10 years as a hospital-based cardiologist, he started Natural Heart Doctor, where people from all over the planet can get the best holistic heart health information and care. He's married to a chiropractic physician, and they have 4 beautiful children. Welcome, Dr. Wolfson. Thanks for being with us.
Thanks so much, Dr. Tim. Pleasure to be on. Excited to share some natural heart health information to everyone who's listening.
Yeah, so tell us a little bit about your migration from allopathic medicine into functional medicine.
Yeah, I became a cardiologist following in the footsteps of my father before me. And after 10 years of medical training, I would start up in the biggest group in the state of Arizona. And in that group, I was a senior partner, and I was doing angiograms and pacemakers and taking care of the sickest of the sick. But I was certainly, I guess I was saying I was unfulfilled only in really, 2 reasons. Number one is that there's so much sickness that's going on, and it's just that the hospital's a revolving door, if you will. People come in, you tune them up the best you can, you send them out, and then they come back in, 1 month, 6 months, 3 years later, whatever it may be, but everybody comes back in. So I saw all the sickness around me, and then I saw the sickness, unfortunately, in my father, the cardiologist who I mentioned. He was becoming sick with a diagnosis that was similar to Parkinson's, called progressive supranuclear palsy. So we took him to the Mayo Clinic, and the Mayo Clinic said they had no reason why he was sick, and they had no treatment for his sickness. And again, the prestigious Mayo Clinic has no idea why my father is sick. And then I am serendipitously introduced to a young woman, and she is a doctor of chiropractic. And she told me all the reasons why my father is sick. Again, the way that he ate, the way that he lived, his mental health and wellness, all these different things that, again, he was really not living well, and certainly not in a healthy fashion. And as simple as that sounds, really, again, when you're a cardiologist like myself, and really you're not trained in the cause of sickness, you're just trained in pharmaceuticals and surgical procedures, stress tests, CT scans, ultrasounds, whatever it may be. Anyway, so I listened to what this young woman had to say. I like to say that, from the stage, I listened, number one, because she's beautiful. And number two, I listened because she's brilliant. And that ultimately would lead me to leave that big group in 2012 and then start my own company, Natural Heart Doctor.
Well, that's awesome. I think we mentioned before when you and I were talking offline that we see a lot of people, a lot of physicians, healthcare providers going from allopathic medicine into functional medicine. But I've never, since I've been practicing since 2009, seen anyone go from functional medicine back into allopathic medicine.
Yeah, not many people do. And I think, for the people who do, it's not because they don't understand the truth of health and wellness. If they do go back from a functional approach, it's really just because the system is rigged against success of the holistic practitioner, right? So, taking insurance becomes very difficult because you spend a lot more time with people. And so now you opt out of the insurance industry. So now these functional practitioners, now they have to rely on people opting out of their insurance system and using, cash, for example. Or maybe it's another thing where it's just the peer pressure that people, physicians are so scrutinized by their peers, by the governing bodies, by hospital systems. So again, they will go back into the mainstream fold. But you're correct. I was just at a huge event this past weekend, A4M, the American Academy of Anti-Aging, which was just full of thousands of MDs and DOs and DCs and PhDs and naturopathic docs and health coaches. And it really is exciting to see the continued evolution, I think, of health information, real health information, and ultimately health freedom of choice.
Yeah, absolutely. Dr. Mark Houston, didn't he do a book signing at A4M this past weekend?
I did. I saw Dr. Mark Houston. He's one of my mentors, and he was there, and it was fantastic to see him. And again, so many others, and it really is kind of like this, a really good community, a community of people who really understand, again, and really striving for health and wellness. Not every one of us agree on every single thing. I've certainly got my preferences in what is how I perceive people to stay healthy, but there were plenty of others. Maybe there's the vegan cardiologists who I ran into, or people who profess one form of technology versus another. But I think ultimately we're all on the path, and really an understanding that pharmaceuticals are not the answer, certainly as it pertains to prevention. I'll wrap this thought up, Tim. Listen, there's a place for emergency care and for trauma centers. Everybody knows that. No one's saying don't utilize that. And again, thank God for our brothers and sisters that are in the emergency rooms doing that heavy work. But that being said, when it comes to prevention, the medical doctors truly have nothing. The statin drugs, the aspirin, the blood pressure drugs, none of these drugs are preventive. They're an attempt at a Band-Aid approach to help people. And that approach is just an abject failure.
Yeah, and like you said, I mean, we're very lucky that we have the acute trauma care that we do. I mean, I think it's the best in the world, or one of the best in the world. When I've had a kidney stone in the past, I certainly wasn't interested in a glutathione push or Myers cocktails. But outside of that, we don't do so well, our medical system. So let's say a new patient comes to you or comes to your practice, and they're migrating over from the traditional cardiology practice. How do you sort of introduce them to this world?
Yeah, a lot of people, of course, they've done their research kind of before they get holistic practitioners. Maybe they've experienced it through family members, maybe again friends who've told them about it. They've gone to read. The power of the internet's a really fantastic thing. It's kind of like if people are insulted as a mommy blogger, if you will, some of these mommy bloggers. Well, a lot of these mommy bloggers that I'm familiar with are pretty darn brilliant. How do they create a mommy blog? Well, they go into the medical literature and actually find the stuff that the actual medical doctors are not even reading. So again, if you look at kind of all the causes of why people get sick, well, that's again what the holistic group of us are really looking at. We're continuing to look at the why. So when someone comes into my office and we have those initial interactions, either with myself, my naturopathic doctors, my team of coaches, my nutritionist, the whole shebang, is that we just take a very in-depth approach and intake. Okay, so let's talk about all the food that you're eating and some of the foods you may not be eating. Let's talk about your lifestyle. Are you getting adequate sleep? Are you getting adequate sunshine? Are you moving in physical activity, or what people would commonly say is exercise? Are they looking into their environment, looking at things like electromagnetic fields, looking at other environmental toxins, looking for water damage and mold mycotoxicity? And ultimately, are they thinking the right way? So assessing all that. What kind of stress are they under? What are their relationships like? How would they describe their community and stuff like that, and their feeling of that? So and then obviously we do so much more, but again, like that takes a lot of time. So when you take that much time, my initial consultations are 90 minutes. When you take that much time, you cannot accept insurance, because insurance does not reward you for that amount of time spent. And insurance companies want you to gather a certain amount of information that you may not even be interested in, because it's really not pertinent to the health and wellness, patients. Again, I'm not interested in the last time the person got a tetanus shot. That's not of my concern. But when you're in mainstream, like they're asking for some of these details and granularity, again, that are just a waste of time as far as I'm concerned.
Absolutely. I couldn't agree with you more. And so when you're talking with patients, or your team is talking with a patient, if someone's plant-based versus keto versus, high protein, low to moderate fat, do you steer them in a particular direction?
Well, the first thing I like to tell people, whether in person or in talking with doctors like you and patients or from the stage or whatever. And I said this a lot over the past weekend when I was speaking again at this event, is that the most I don't want to say the most important thing, but I want to say one thing we can all agree on is to get the chemicals out of our food. So the healthiest of the vegans and the healthiest of the paleo people and the healthiest in the keto and even the carnivore space, they appreciate the quality of the food and keeping the chemicals out. So the person who professes the vegan diet should also be professing organic vegan. If you're going to eat plants, if you're going to eat nuts and seeds, if you're going to eat avocados and coconuts and olives and all this kind of stuff, right? We just want to make sure that it's organic. We're getting the chemicals out. If you're going to eat grain, make it organic. We're not, avoiding artificial sweeteners, artificial colors, artificial flavors. But on that same thread, and again, you know who these people are, and I spoke at, different paleo events and keto events, over the years. And there's definitely a dirty paleo, and there's a dirty keto, and there's a dirty carnivore. So when we talk about eating animal products, it has to be free range, grass fed, grass finished, pasture raised, all these buzzwords that we're looking for. Essentially, we're looking for healthy animals that led a healthy life on their native foods, and then they are sacrificed for the consumption of a human in order to realize what I would say is our optimal health. Listen, I didn't write the book. The reality is that the paleontologists, anthropologists, Mother Nature, they've been documenting this for many years. And again, the 3.5 million years of literature about how we are eating animal products, and that's how humans are built. And again, you can look at some of these survivor shows, where you got someone who is on a TV show like Alone or Naked and Afraid, and if they're a vegan showing up on that show, they're either quickly switching to animal products, or they're going to tap out of the show. They're going to quit because there's no bowls of oatmeal and bags of walnuts waiting for them, and it wasn't waiting for our Paleolithic ancestors. We were hunter-gatherers. It's just the way it was. It's just common sense. And that's how I approach things now.
Yeah, I agree with Sean Croxton, formerly of Underground Wellness, when he came out with the JERF, just eat real food. Everyone's kind of bickering back and forth about, oh, eat this, don't eat that. He's like, listen, everyone's missing the point. We just got to eat real food.
Well, I think that's a cool acronym. I like that. But, again, like that being said, it's like, to me, I don't eat wheat bread. I don't eat, those grains. I don't eat any kind of, I don't think that grains serve any need or purpose in our body. So we do eat a lot of wild seafood. We eat a lot of nose to tail animal products. We have a lot of preference for things like lamb or bison. We do eat, cow, we eat chicken and turkey, but again, really getting in that nose to tail part, the liver and the heart and the other organs. And again, just from the healthiest animals in the world. And, again, I guess, because I think, Dr. Tim, we could kind of mix up the real food. Well, I guess, wheat bread, I guess, is kind of real food, and stone ground wheat bread. But if it's not organic, it contains pesticides and things we want to avoid. But ultimately, I think the best approach, is again, eggs and avocados and coconuts, a lot of these fatty foods that they've told us to avoid. I mean, certainly, I think that if you go to that concept of just eat real organic food, that's probably going to put you in a pretty good, put most people in a pretty darn good space.
Absolutely.
And I want to say one more thing too, Doc, is that sometimes we really should focus on what are the foods we should be eating. And if you eat a lot of those foods, then it tends to crowd out a lot of the stuff that that you should not be eating.
Right.
So if we say, hey, eat a lot of seafood, eat a lot of nose to tail nutrition, eat a lot of avocados and coconuts and olives, and eat a lot of green leafy vegetables and sulfur rich vegetables, and eat fruit, but not too much and keep that in moderation. Obviously, everything, like I said 50 times already, it's all organic. So when you're doing that, there's really not much room for some of the other stuff. inside of, that just eat real food, paradigm.
Yeah. One thing I was going to ask you based on, you mentioning plants and oatmeal, things like that, the misguided information that traditional cardiologists share, low fat, high carb, but insulin's arthrogenic. I mean, it generates arterial plaque, right?
Yeah, doctors, this is so well known. Harvard University, many others will demonstrate that the medical education system, the education of the doctors, does not contain anything about nutrition. So essentially, we go, if we say anything at all, it's usually because we're asked a question, and then we'll divert to the guidelines and say, well, yeah, low fats, go with low fat, go with low cholesterol foods. And that's pretty much, the message that we've been told for the last 50 years. Yet heart disease, remains the number one killer worldwide. Fat is not the problem. Just to your point, when it comes to food, obviously after all the chemicals in the food, then I believe I agree with you. It does go to foods that tend to spike insulin, and insulin is it's an energy hormone, that is responsible for storing food as energy in fat cells. And ultimately, the other thing that insulin does is that it actually increases the function of the HMG-CoA reductase enzyme, which actually could produce more excess cholesterol. So I think in that scenario, I'm not afraid of cholesterol, and I don't think anybody should be. But again, we should find the perfect levels for each one of us, and then of course, make sure that those lipids are not damaged as well, and that goes into a big part where we talk about this imbalance that relates to what's called oxidative stress, which certainly is the real culprit for all disease, and certainly cardiovascular.
Yeah, from what I know, and you correct me if I'm wrong, but LDL in and of itself is not bad until it's oxidized, correct?
Listen, it's just, again, it's like that common sense approach, but unfortunately, the medical doctors and the pharmaceutical companies have just led, purposely or not, led people down the wrong path. We call LDL is the bad cholesterol. Well, if it's so bad, why does every human on planet Earth make it? If it's so bad, why do all mammals make LDL? That low density lipoprotein, again, which is made in the liver, that is thought of as like a bus. And that LDL bus made in the liver takes off from the liver with a bunch of passengers, and it delivers those passengers all around the body. And if it doesn't, we're going to be dead. We're not going to live without that kind of, again, moving the amazing proteins and fats and energy particles that are made in the liver and moving them to the rest of the body. And that's done in the LDL bus, as much as the HDL bus picks up things that are no longer necessary from around the body, brings it back to the liver for recirculation. So again, all that stuff has purpose. And to your point, again, we kind of can think of the oxidized LDL or the damaged LDL as that LDL, as that bus travels around the body, it gets smaller and smaller and smaller, and picks up a lot of just metabolic damage that occurs. It's kind of like if you think about a big bus driving around a city, and then over time, like that bus, if it were to get smaller and smaller, but certainly the bus gets damaged, right? Somebody draws graffiti on it, or a rock, is thrown at the bus, or it bounces up and it hits. I mean, again, like the damage, rust happens to the bus, and the rust is actually a fantastic example, because rust is oxidation of iron, and that LDL particle, again, as it gets older, it can oxidize. Your doctors need to measure it. Therefore, and that'll help you to really understand your level of what's called oxidative stress. And then ultimately, different strategies to reduce the number of oxidized LDL particles. And there are certainly many of those strategies. In the natural realm, the traditional cardiologist has one strategy well, let me say this, two strategies as it relates to cholesterol and lipids. Number one, statin drugs, which are the number one selling drugs worldwide. And then number two, there's a new class of pharmaceuticals that was released about 5-6 years ago that are extraordinarily expensive, are very good at lowering numbers down, may actually lower your risk of having a heart attack or the need for a cardiovascular procedure, by a little bit. But it turns out that in the drug group versus the placebo group, as reported in New England Journal of Medicine, 18 more people died in the active drug group. So there's no free lunch in the cardiology space. You have to do the work. You have to, make the effort. That is our chance to make it to the 100-year heart.
Absolutely. And so we've talked about, nutrition for a healthy 100-year heart. And you've mentioned some lifestyle scenarios and factors such as sleep, movement. What other lifestyle factors do you coach your patients on?
Well, again, it's, we all tend to argue about the food story, right? That seems to be everyone's got their opinions on that, but food is no more important. Again, the concept of eat well is no more important than living well, and those are no more important than think well, and they all go in, to each other. So again, if you're not thinking well, for example, if you are stressed, if you're anxious, if you're under fear, if you are depressed, you tend to reach for bad food. No one is saying, I'm depressed, I feel like I'm going to have a broccoli salad or chew on some freeze-dried liver. Again, we go for those comfort foods, those bad foods. So again, when we have the best thought processes, that tend to support everything else. We want to exercise more. We want to be outside more. We want to be physically active more. So again, that whole concept again of starting off with sleep. Our ancestors went to sleep with the sun down. They awake, with the sunrise. They watch the sunrise. They're all day, they're in and out of the sun. It's just the way all animals, all plants are. They're all outside. We're the only ones who are stuck, inside. So those are kind of components of that live well. And then ultimately, we want to look at other things too. Is inside live well, I recommend everybody get chiropractic care, everybody get holistic dental care. And then we get into the environmental toxins and pollutants. And that category is very big as well. And that could be things like electromagnetic fields. I know I applaud you, Dr. Tim. So many people, even in the holistic space, they're wearing earbuds, where we get like this Bluetooth in their ear. And now, so, you have like this battery and this radio in your ear, and then it connects to the other one and in between your brain. So that's not good. So EMF is one thing, and other toxins like, metals and, lead, arsenic, cadmium, mercury, aluminum, all those things are bad. And pesticides are bad, and air pollution is bad. But I'll say one final thing about this. Those aforementioned chemicals, and again, there's 70, 80, 100,000. There's so many we can mention, plastics and all these other things, phthalates and parabens and VOCs. The list goes on and on. But none of those, I believe, are potentially as dangerous as the mold mycotoxin, because mold from either food or more dangerously, I think, from water damage in a home or in an office, the water damage happens and mold grows. And here's the thing, the mold mycotoxin, the molds release a toxin, and that toxin wants to kill off things in its environment because it wants to survive. It's a living organism that's been around for potentially 600 million years to actually 1 billion years is how long fungus has been around. So it knows how to survive. So in that survival aspect, it sends out these toxins, its Army, Navy, Air Force, and Marines, to kill off other molds that may get in its way, or bacteria, or viruses, and certainly birds and insects and humans. And it's in the literature. So we know this most commonly when we think about, this mold mycotoxin. What does that really mean? Well, we know that the penicillium fungus produces a toxin that kills bacteria, and we know that as penicillin. There is also another mold mycotoxin called mycophenolic acid. And in mycophenolic acid, that is a tremendous immunosuppressive. So that the fungus uses, again, to damage any other bacteria or fungus in its way. Well, that immunosuppressive was harnessed by pharmaceutical companies, and that is a pharmaceutical used to prevent organ transplant rejection. So if someone gets a new heart or new kidneys or new lungs or new liver, that's one of the pharmaceuticals they put people on. And all it is a mold mycotoxin inside of a capsule that, of course, they charge, $2,000, a month for. But that's all that it is. I mean, these are very dangerous particles put out by the mold. If you're living in mold, you better figure out how to get out of it. If you're not sure, you better get tested.
Yeah, absolutely. I couldn't second that any more than I already do. A colleague, an MD colleague in 2009 gave me a copy of Dr. Shoemaker's Mold Warriors book. And that's when I first started learning about it. And what I had to understand, and what I've come to understand, is that mold behaves very differently indoors than it does outdoors. And a lot of people think, oh, because my house is new, it can't have a problem with mold. But it may actually be more problematic because there's not a good indoor-outdoor exchange of air. And so the mold, it's kind of like in your microbiome, you have just a handful of species that grow uncontrollably. And so mold, to your point, I know when I had a high mycotoxin load, my blood pressure went up because it lowers vasoactive intestinal peptide. So I took that via nasal spray, and that brings back, some of the blood flow to the frontal lobe, but also systemically. But yeah, don't, if you're listening, don't go by what you see or smell, just get tested. Chances are you've been exposed somewhere, somehow. And it can only help by getting the mycotoxins out.
And, to your point is that it doesn't matter if the home is new. Again, it just needs to have water damage. The house could have been, you could have moved in last week, and there could have been damage that occurred in the week of when it happened, and even during the construction phase. So how many homes are built out of wood and they're left in the elements, and then they get saturated with water and they already start growing mold before you move in? And then to your point, Doc, is that the homes, certainly over the last 20 years, where a lot of changes were made, again, in order to be more energy efficient homes, they just kind of lock everything in. So therefore, the exchange with outdoor air is actually very poor. Our ancestors, and meanwhile, mold mycotoxicity was discussed in the Bible. So 3,000-4,000 years ago, and I'm sure many years before that, they knew that mold in a home was very dangerous. And now their homes were different, of course, back then, being made out of rock and clay and whatnot. But that being said, they knew if there was a problem, what to do about it. Our homes right now, so many times, like you said, you can't see it. It's inside the walls, it's under a sink, it's under a shower, but those toxins are getting out. So not only the mycotoxins, but also the gases of that. And I think, to your point, Tim, when you walk into a place and like, oh, this place smells musty, or this reminds me of like my grandmother's house. That smell is nothing but mold, and those noxious gases that are getting out, they cause an effect. The mycotoxins cause an effect. The mold itself and the spores that are released, they cause an effect. And again, the medical community is just not talking about this whatsoever. And yeah, Dr. Richie Shoemaker, medical doctor, who brought this, to the world, 15, 20 years ago, and many others are expanding on that work, and he continues his work, but mainstream is still way, way, way behind. And I guess I'll finally say this finally, whoever's listening, whatever your health issues and concerns and symptoms are, please consider that they are mold related.
Absolutely. I had a guy I was working with who was about to go to BUD/S, Navy SEAL training. And I said, well, I can't determine or play a role in what goes on there, but I can just make you as resilient as possible. So we worked on, peeling away the layers of the onion. And I said, well, let's test for mycotoxins. He's like, oh, I don't have them. I said, I'll do this. If your mycotoxin test comes back totally negative and it's been provoked, then I'll pay for the test. And so we did it, and he had at least 2 mycotoxins that were off the charts. And so he made it through BUD/S training. But so I'm proud of that. Hopefully I played a small role in that. But yeah, to your point, there's so many causes of cardiovascular problems outside of, just oh, the heart malfunction. I remember reading literature 15 years ago that Coxsackie B virus type 4, if those titers are elevated, you have a 33% increased risk of a cardiovascular event.
Well, and to that point again, and that just shows like immunodysfunction. Like our body was built amongst the fungus, amongst the virus, amongst the bacteria, amongst the parasites, and the healthy human can combat that. And when we don't clear out things like Coxsackie, or we don't clear out things like cytomegalovirus or Epstein-Barr virus, of course, famously, and the tick-borne illnesses, such as Lyme and others. Again, if we are mold toxic and if we are therefore immunosuppressed, we can't clear that stuff out. So that's why, again, we got to look at really supporting the immune system. And again, like to your point, as far as like the athletes are concerned, or people entering buds, or those of us who deal with professional athletes, everybody on average is going to be more successful when their health is optimized. Right? When they're talking to you and you're talking to them about food and lifestyle, and you're talking about healthy thoughts, and you're doing the most advanced testing in the world, we're really optimizing human performance. That could be for a professional athlete, could be for someone just trying to survive, buds training, or it could be for a high level, executive who wants to make sure that his or her brain is functioning at their best. Their energy levels are at the best. The clarity is at the best. The vitality is at the best. And they're not even, you can't even scratch the surface of that in a traditional medical office. Yeah, I think, Dr. Tim, it's really just, it's sad. It's just sad for the world. It's sad for the medical doctors who never learned the truth like you and I did. They're just spinning their wheels in the pharmaceutical factory. And it's again, it's a shame, but I appreciate the opportunity for you having me on and for me to share my thoughts and everything you're doing, with the podcast and getting the message out there, because that's how we're doing. You're not going to hear the stuff from the medical doctor. You're going to hear it from, from people who really know.
Absolutely. Well, thank you for the work you're doing. To play off your last comment, it seems like almost all of traditional medicine is procedurally based. And my ex-girlfriend's a traditional dentist. And one time she said, I don't understand why these people are paying you. You're just talking to them. And I said, so I'm not drilling a hole in their mouth? That makes it less valuable? And that's kind of the entire mindset, is it not?
No, it certainly is. And of course, your mindset, from your standpoint, that's probably why she's your ex-girlfriend and not your current girlfriend, because that you are so much more valuable to the patient than she is. Now, she may be more valuable, again, if the tooth is infected, it's dead, it needs to be pulled, the patient is in an extraordinary amount of pain. Again, there is a time and a place for emergency dentistry, but again, and even that should, of course, be done under a holistic dentist. But again, I left the biggest group in the state of Arizona. There were 40 plus other cardiologists and cardiovascular surgeons in the group, and nobody wanted to hear what I had to say. It's, you're really shaking the absolute foundation of a medical doctor's existence when you're telling them the things, and telling them what they don't know. They don't want to hear that. They don't want, it's not good for them financially. It's not good for them emotionally, unless of course you can spur them to make the change, and understand like we do.
Absolutely. So when you have a patient who comes to you, they may have some testing that was done previously, but what are the most accurate tests to give someone an idea of their overall cardiovascular health? Like, most people have heard of coronary calcium scores, but what other tests are there?
Well, I'm not a fan of the coronary artery calcium scan. I'm not a fan of CT scans, and trying to avoid them whenever possible. So to use a diagnostic tool, such as a CT scan, again, which is radiation based, to determine if someone has disease, I don't think is very beneficial. Ultimately, any form of radiation and any amount is not going to be good. So why why do that? So say, for example, someone they want to go for a scan. I'm not going to treat them any differently, Dr. Tim, just like you're not going to treat them any differently, whether their score is 100 or their score is 1,000, showing a lot of coronary calcification, or their score is none. Well, now, what if their score is none? And what do we say? Well, okay, continue drinking and smoking and eating whatever you want. You're in good shape. Well, that's not a good methodology. And again, so no matter what someone's score is, it's not going to change what I do. In the past, it could be said, well, if their score is high, then you will put them on statin drugs. If their score is normal, then you can hold off on statin drugs. And I could understand another doctor utilizing that philosophy. Me personally, I'm not going to do statin drugs, so I'm going to use the most advanced lab testing in the world to determine what the risk is, right? So we're going to look at the advanced lipid particles and the other metabolics like blood sugar and insulin, and we're going to look at all the inflammatory markers, and we're going to look at homocysteine and Lp(a), and we're going to do intracellular vitamins and minerals, and we're going to do leaky gut and food sensitivities when indicated, and we're going to check for mold and environmental toxins and metals, right? So when you're doing all this stuff, you can imagine it takes a lot of time to discuss the results with patients. So again, another reason why kind of that insurance-based model is not gonna in its current state is not gonna work, for practitioners like us. But not a fan of the CT scan. And ultimately, I think what happens too is that a lot of people I've seen over the years, this happens to them. They have a CT scan. Well, let me say this: they have no symptoms whatsoever. Let's say it's a 50-year-old guy, call him 52, just like me. 52-year-old guy, feel fine. I eat well, live well, think well. I go to a doctor and they're like, oh, you should get a CT scan. Or maybe a friend says, get a CT scan. So I get a CT scan and it shows that I've got, 80th, 90th percentile coronary calcium. And now I'm concerned. I'm like, whoa, I had no idea. So I go to the medical doctor, I go to my cardiologist, like, well, you have all that. You should probably have a stress test to see if there's really a significant blockage there that's causing problems. And I'm like, well, okay, I don't know any better. I'm just I'm a stockbroker, or I'm a mail carrier, or I drive a truck for a living. I don't know. Okay, so I go for a stress test. Oh, well, it's a little bit abnormal after the stress test. And then now we need to do an angiogram. And now we do an angiogram and like, well, there's a blockage there. It's not critical, but I think we should probably stent it. So now you've taken a person who was 52 years old, feeling perfectly fine, and then you radiated them. You did a stress test that likely contains more radiation for a nuclear stress test. And then you did more radiation, which is an angiogram. And then you put in a stent, and the stent releases tiny amounts of chemotherapy into the body. And that's a whole nother story, but it does. And then you're on pharmaceuticals, at least for a year, or certainly, and possibly in perpetuity. All the while, Doc, you felt normal, you felt fine. And that whole procedure of what I just described does not save any lives. It doesn't prevent heart attacks. It doesn't do anything.
It stresses you out.
In the medical literature, it stresses you out. It creates all kind of negative things that can happen to you. But again, stents and surgeries are for people with symptoms. If you don't have symptoms, you don't need stents and you don't need surgeries. And again, that is in multiple high-powered studies in mainstream cardiology literature.
Absolutely. One thing that I've been interested in for a number of years, but I've gotten into more recently, is looking at malocclusion and sleep disordered breathing. And I think most people, we've kind of normalized as a society snoring, even though it's certainly not normal. And I'm working with an integrative dentist who, expands the upper jaw, gets you breathing correctly. But can you touch on, for people who may not know, the connection between sleep disordered breathing, intermittent hypoxia, and cardiovascular risk?
Yeah, and I think, really you just kind of, we just kind of keep going in all these different areas about all these different problems. And you can see how difficult it is for us to be helping patients, if you will, only in the sense of there's so many things that we can offer and so many things we need to offer, as opposed to the traditional medical doctor. Hey, Dr. Tim, how you doing? Well, listen, cholesterol's a little bit high. Here's your statin drug. Blood pressure is a little borderline. Here's this drug. You should probably take an aspirin along, with that. And, just to be safe, get a stress test. All that stuff is totally wrong, but the whole conversation takes less than a minute. Less than a minute. Hey, blood pressure's high. Here's your pill. Bye. That's 3 seconds of conversation. And now you and I want to start engaging in the conversation about, what about sleep disordered breathing? What about intermittent hypoxia? What about tongue tie? What about the rest of the oral pharynx? And then, of course, getting into other dental health issues, root canals and retained ligaments and cavitations and periodontal disease. And I mean it just goes on, which is, again, and I'm sure you've interviewed fantastic guests for your podcast just specific about that. Listen, the bottom line is, to ultimately answer your question, yeah, I mean, we need to test our patients for sleep apnea. There's fantastic home tests. You don't have to go into some sleep center anymore and get it done there. You can do the testing safely in the comfort of your own home. And if you have sleep apnea, then ultimately it's not a matter of, well, let's get a nasal, BiPAP, or let's get a CPAP machine that people need to use. Let's continue to figure out, okay, why? We've identified that you've got sleep apnea. It's a risk factor for heart attack, risk factor for heart failure, risk factor for stroke, risk factor for atrial fibrillation. It's a risk factor, again, for every cardiovascular disease and every other condition as well, either been studied or will be studied to show that it is linked to it. And again, so in the conversation about sleep, yes, we ask people, what time do you go to sleep? What time do you wake up? Do you snore? All the symptoms associated otherwise with sleep disordered breathing. Again, right? Do people feel fatigued? What's their energy levels? Daytime somnolence, napping and stuff like that, right? So asking them all those things as it relates to their quality of sleep. But I mean, your point is very, very, very well taken. And the mainstream doctors know this, and a lot of them are good at it, but a lot of them are not good at it. I mean, can you imagine? I still see cardiology patients for second opinions, and they've been under the care of another practitioner, and they clearly fit the mold of someone who has sleep disordered breathing, or someone who has sleep apnea, and they've got the cardiology conditions, and they've never been tested. And I'm baffled. I said, every medical doctor is familiar with sleep apnea. No one told you to get a sleep study because you have AFib or because your blood pressure is high. No one's ever said that. And oftentimes they've never been tested.
Yeah. And I don't know if your background as an osteopathic physician, with a slight more focused on orthopedics, gave you that insight. Do you think that helped you with your transition into functional medicine?
I'm going to say diametrically no. I'm going to say no. I'm going to say that again. It's a great question, and I've been asked that many times. And actually, I've been told that, well, you think this way because you're a DO. I would hope that's the case. The reality is, most of the DOs that I went to school with, they're just like the MDs. The MDs and the DOs who have left the space of conventional, mainstream and gone holistic. I think there's as many on a percentage basis, again, but, the osteopathic training, really is based on that whole patient philosophy, and really taking the time to be able to understand, where patients are coming from, looking at the spine and of the muscles, kind of similar in that chiropractic sense. But again, certainly amongst the specialists, the DOs who went into specialties, cardiology, pulmonology, nephrology, they're just like the MDs. And again, we'll keep pushing. We'll keep trying to get them out of that matrix.
Yeah, most of the DOs that I know answer the question the same way. And they say that, the majority of their DO friends who are still in the allopathic world, they're just an MD, who might have had some more orthopedic training, but, unless they switch over to functional medicine, they're still just missing the boat from a lifestyle.
Yeah, I think that, to kind of add one more point to that as well, is that I wonder if the DO even gets like more defensive. Like the DO is trying to be like a real medical doctor. Like they want to make sure everyone knows, that, hey, I'm a medical doctor just like the MDs, are. So I guess in theory, in some cases, they could even swing kind of further to the other side, because of that basis.
Yeah, and that's unfortunate. But you've given us a treasure trove of helpful information. If people want to find you, want to work with you, want to work with your team, naturalheartdoctor.com, where else should they find you?
Yeah, no, thanks so much, Doc. Naturalheartdoctor.com is our website. If you want to get a copy of my book, The Paleo Cardiologist, The Natural Way to Heart Health, again, where you've got nutrition information, but also all the other things that we've been talking about as well. Your listeners can grab that for free, freeheartbook.com, freeheartbook.com. You can go buy it on Amazon. You can buy it at other places. You can give Amazon more of your money. I don't think they need it. You can get the book for free. Just pay shipping, freeheartbook.com.
Awesome. Well, thank you so much. Hopefully we can have you back on in the future. I know you're a super busy guy, but have a blessed holiday season to you and your family.
You too, my friend. Thank you so much.
Take care.